We make lives better.
Nosotros mejoramos vidas.
We make life better.
हम यहाँ पे एक बेहतर जिंदगी बनाते हैं.
We make lives better.
نحن نجعل الحياة أفضل أو نحن نحسن الحياة.
We make lives better here.
Welcome to the virtual season of interviewing, our first. This is new to all of us, to every institution that you'll be looking at and interviewing with. So we're going to do our best. Is it as good as meeting you in person? I don't think so. So what I want to do is spend some time with you going over what our program is and maybe advertising it a little bit. At UT Radiology, we have 4 missions. The first, of course, is to provide excellent patient care. The second is to provide excellent training for our residents, fellows, and our medical students. The third is research, of course. And the fourth is community outreach. We take these all very seriously, and you will be able to take part in all of those missions. I want to talk especially to you about our education mission, because that's what you're looking at us for. We have excellent help in the education office, to include our program coordinator, which is Kevin Green. And then he has 4 assistant program coordinators, which would be Edie, Steffi, Bianca, and Megan. I put them in that order because that's how long they've been here.
Most students are looking for a culture that is supportive, that they feel that when they come to our institution, they're going to feel part of the team, included in the decisions that we make, that their constructive criticism is going to be heard and action is going to be taken up on, and that you're going to be supported in trying to be the best clinician radiologist that you can.
We have 2 separate residency programs at this institution. Dr. Gomez is the program director for our Diagnostic Radiology program, and Dr. Croma is our program director for the interventional program.
We have our program established here since interventional radiology recognized as a subspecialty in 1994. Our program is approved for IR residency early 2017, and we have integrated independent IR residency. We also approved for the ESIR in 2019, early 2019.
Obviously, I want to improve and continue to progress with the educational content, but also I'm interested in trying to have more national exposure to our residency program, because I believe we have all the tools that we need in terms of faculty, resources, and residents to be one of the best residency programs in the nation.
So let me tell you a little bit about San Antonio. San Antonio is one of the fastest growing cities in the nation. It is the 7th largest city in the nation, but it doesn't feel like a large city. The school systems here, public and private, are very good, but both are available for you if you have children.
I'm from San Antonio, so I'm biased, but I think it's a great city. It's low cost of living, there's tons of affordable housing options. I live a mile from the hospital right now in a neighborhood where there's a group of 150 to 200 peacocks that roam the neighborhood that make it unique and fun, definitely fun for my kids. But great family city, lots of stuff to do, and pretty much anything you could ever want or need to find, you can find it in San Antonio.
Our program is affiliated with the University Health System. Currently, it is called the Bexar County Hospital District. So our tax dollars go to support this system. The patients that we serve here are served equally well. Whether or not they have money, we're able to provide excellent care for everyone that comes into our system. It's a privilege for me to serve with University Health System, and part of the reason I've stayed here forever is because the people they serve and the service that they give to their patients, along with UT Health, is so outstanding and inspirational. The University Hospital is a 675-bed hospital, which is getting ready to expand with a new women's and children's tower, which should be completed in 2024. So you'll be able to take part in that. In addition, UT Health has decided to build a hospital close to the main campus. That is planned to open in 2024 also. UT Health also has plans to expand into another outpatient clinic, which will be north of town. We were hoping to have that open in 2022. However, with COVID, that has been delayed, and hopefully it will open by 2024 also. The focus of that clinic is going to be on healthy longevity. So it will be a clinic to help us age gracefully, and it will also provide research opportunities. So there will be a research component to that facility. University Health System has numerous outpatient facilities scattered across the city and the county. The biggest is the Robert B. Greene Outpatient Clinic. It's a 6-floor structure. One of those floors is primarily radiology, where we have excellent equipment to care for our patients on an outpatient basis. We also have an outpatient surgery center there, where the interventional radiologists practice their care for patients in an outpatient setting. In addition, we have UT's private practice, which is located at the MARC, the Medical Arts Research Center, which is close to the University Hospital. And we have an outpatient clinic called UT Hill Country Clinic, which is out north of town near Boerne. We also have an outpatient cancer center called the Mays Cancer Center in partnership with MD Anderson, and we have been in partnership with them for now 3 years.
We're also one of 4 NCI designated cancer centers in Texas. So we see a lot of cancer patients. We are involved in a lot of clinical trials, and we really have a lot to offer for our patients here. Our first-year residents do biopsies on the breast rotation, and that's something that you won't see at all programs. But the best way to learn is by actually doing. There's this saying, see one, do one, teach one, and that definitely starts your first year.
From a very early training point, our trainees get scrubbed into the case. They get involved with the instruments of the case. They get involved with how to prepare the tables. So I very quickly try to progress my trainees from introducing the procedure to participating in the procedure to performing the procedure. By the time a year passes, if you've been training with me, I'm pretty much sitting in the control room making sure that that case is going from beginning to end exactly how it should, and that you have all those parts down.
We take the training of our residents very seriously. And why is that? It's because you're going to be taking care of patients, our prime responsibility. So we provide for you the opportunity to become patient-centric, collegial, and competent. How do we do that? We do that by teaching while you're doing. We are a high-volume institution, and we think residents learn best by doing, not by reading about what they need to be doing. Certainly, are you going to read? Yes, you will read approximately 2 hours every day, but you will be practicing radiology 8 hours a day. And we think that's very important. What's important about that is during your residency, you want to see as much pathology as you possibly can. And the only way to see it, and I mean actually see it and experience it, is to interpret images. If you come here and you do your part to study, you will leave here an excellent radiologist that is board certified, who can obtain excellent fellowships, and after fellowship, an excellent job, either in academics or in private practice. We are very proud of the residents that we produce from this institution. And our residents are known by other people as the residents that can actually come out and practice radiology excellently and accurately. We look for residents that are willing to put in the work so that they can become excellent. So you may be asking, what rotations as a resident will you go through? You will go through breast imaging, and intervention, abdominal imaging and intervention, interventional radiology, of course, musculoskeletal radiology and intervention, neuroradiology and intervention, nuclear medicine. I just want to put a side note for nuclear medicine. We're starting to get into diagnostics where we'll actually be treating patients. So it's an exciting new time for us. We have pediatric radiology and ER radiology. We do have 24/7 faculty coverage for our residents that are in the ER. We do, however, allow preliminary reads to go out so that you learn to interpret things well. You feel the responsibility of interpreting things well, but you also have 24/7 backup. So if you have a question, you can call, but we do like your ER experience to be the one where you gain confidence in your own skills.
The strength of our program is the variety of the cases. And we see everything from, the typical bread and butter cases to like very rare cases that you may not even see in the literature, that you have to be the first one to put it in the literature.
Historically, we have had Holman Pathway residents, which are invested in research. And for many years, we've had an MD PhD program, meaning you do your residency program in radiology and at the same time you do a PhD in physics. So those things make this place special in terms of the UT Health San Antonio.
This year, we have a new opportunity for our residents entering our program. We have partnered with UTSA to offer a master's in business administration while you're getting your residency training. We will take a limited number of applicants into that program who are showing excellence in their education as radiologists. I would love to be able to say to you that I could pay your full tuition. I can't. But UTSA offers this program at a discounted price for our residents, and they are really working it so you can work it through your schedule with your residency. Medicine is a business. I mean, it's first and foremost about patient care, but as my good friend always told me, if you go broke being a doctor, you're not treating anyone. You do need to know the business of medicine. And I think having a master's degree in business could be very helpful as you go out into your practice. So in summary, I hope that this has been helpful for you. I know it's not as good as you being here in person so that we could interact more, but for now, this is what we're left with. I can guarantee you, if you come and you partake seriously of all the things we have to offer, you will leave here a great radiologist who will be board certified and get a great fellowship. But it really is up to you to make that decision.
During the interview season, we try to make sure this is really what you want. You come here and you hook up with us, and there's a system in here that you follow. We want to make sure that system fit you, and that's what you're looking for.
We have an environment which supports self-growth. There is always emphasis on developing your skills, or there are opportunities that are given, and you can choose from whichever is your area of expertise and wherever you want to grow. So there are people to help you out in each of those areas.
After having done my internship already in clinical medicine, did my nuclear medicine residency, and then went into being faculty here at UTSA. And then after several years, I decided that I wanted to explore other sections of radiology, and then went into Diagnostic Radiology Residency, which was actually an interesting path, having been a resident, then a faculty staff member, and then going back to being a resident and being in the ER overnights with residents and dealing with all kinds of different stuff, but have really enjoyed every moment of it, and absolutely no regret, and just very, very happy that I did make those choices.
We hope that you want to join us here at UT Health, what I call the wonderful worlds of radiology, where we make lives better.
We have a great team. I feel like, you know, this is my home, not even second home, this is my home.
Once again, if you have any questions, please contact us and let us know. I wish you the best.